Thank you so much, and thank you to all of you today for joining us for the National Alzheimer's and Dementia Resource Center webinar, Sharing the Care for Families Dealing with Alzheimer's Disease or Related Dementias, Alabama's PANDA Project. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. At this time, I'll turn the floor over to Erin Long of the Administration for Community Living for a brief welcome. Erin?
Hi, everyone. Thanks so much for taking the time out of your schedules to join us today to learn about the wonderful work that they're doing across Alabama through their ACL funded grants. I want to thank Robin James from the Middle Alabama Area Agency on Aging and Stephanie Holmes from the Central Alabama Area Agency on Aging for sharing their wisdom with us. And with that, I'll give it back to you, Sari.
Great. Thank you so much, Erin. As you heard, our presenters today are Robin James and Stephanie Holmes. Robin James is the director of the Elder Justice Center of Alabama. Ms. James previously served as the director of marketing and innovations at Middle Alabama Area Agency on Aging, or M4A. In this capacity, Ms. James collaborated with M4A staff and stakeholders to create and oversee the PANDA Project, Alabama's dementia-friendly training program for first responders, and the creation of the new Elder Justice Center. Ms. James has spent her entire career advocating for older adults in various capacities so they can age in place with dignity and independence. Also with us today, we have Stephanie Holmes. She is the PANDA Project Director for Central Alabama Aging Consortium, the Area Agency on Aging in Montgomery, Alabama. Stephanie is honored to work with CAAC and the Administration for Community Living to implement a grant that will help people living with dementia, people with intellectual and developmental disabilities, and their caregivers. Stephanie's love and adoration for her two grandparents who passed with Alzheimer's disease pushes her every day to fight for those who cannot remember. At this time, I will turn the presentation over to Robin James to begin. Robin?
Thank you so much, Sari and Erin, for having both Stephanie Holmes and I this afternoon. I wanted to also, on behalf of Stephanie and I, thank all of you who are in attendance and just providing us the platform and the opportunity to kind of showcase the PANDA Project. And PANDA stands for Providing Alzheimer's and Dementia Assistance. We did receive a 3-year grant from ACL, the ADPI grant. And so as we take you through this afternoon session, we really have learned a lot of things and we've collected a lot of data, but we are waiting on the data to be finalized. And so maybe we will have a future opportunity to really showcase the outcomes of the PANDA Project. So the goal of the project, we piloted this project in one county in Alabama. It's centrally located, Shelby County, and it's the fastest growing county in the state. And we have a lot of resources and partners that we had already developed over many years. M4A has been around since 1989. So we just knew that that was a really great county to create this project. So the goal of the project is to really enable people with Alzheimer's disease or related dementia and those with intellectual and developmental disabilities to remain in their homes, age in place in their community, to allow those unpaid family caregivers to continue to provide support, to reduce hospitalizations. We know there's a rapid growing rate of readmissions, and so we really wanted to address that issue and to reduce overall costs. And again, we will have data later this year for that. Next slide. So I will say that when we applied for the grant, we did not get the grant the first go around. And I'm going to talk a little bit more. I think that was actually a blessing in disguise. And I'm going to share a little bit more in detail about what we did to really strengthen our application the next go around. So the main objectives we had come up with was to develop an integrated, not just a person-centered, but a family-centered, those support plans. And what makes PANDA very unique is all of our other programs, our Older American Act programs and our state Medicaid, we also administer the Medicaid waiver programs. Typically, you have one client in the home. For PANDA, we have 2 clients or maybe more. We have the primary family caregiver and we have the care recipient. And so that really makes PANDA very unique, where both persons in the home are getting care. And so I love the title that we came up with, because truly PANDA helps share the care in the home. The objective was also to create, deliver, and expand our dementia, not just our dementia-friendly training. Our agency had developed in early 2018, we got a $10,000 mini grant, and we saw that first responders really were not receiving any training at all on dementia-friendly. So we reached out to the National Dementia-Friendly organization, and we did some research, and we developed a curriculum specific to first responders. And I'm going to talk more about that at the end, just the value of having that partnership in place. But we also created, delivered, and expanded just dementia training in general for, family caregivers, for community members, and for professionals. And then also a main objective was really to just provide that very person-centered support and services and care plans in the home. Next slide. So how did PANDA came to be? Well, first I will tell you, a colleague who was the previous project director, she actually came up with the name PANDA at 3 o'clock in the morning, and she added in a dream. And so we like the name because people remember the name. So that's just, I think, pretty significant to come up with a name that people can recognize. But when we conducted all of our dementia-friendly first responder training, it really became apparent, first of all, when we asked, how many of you in this room have a loved one, a family member who has had some form of dementia, and half their hands would go up. And they would tell us stories of their wives. They've moved their older, parents into their home. So they were struggling in dealing with it. And so just knowing and we started our dementia-friendly training in Shelby County as well, really in partnership with the Sheriff's Office. One of the biggest things that we identified as a wonderful tool, and I'm sure Sari and Aaron could get the link at some point, but we used the ACL Dementia Capability Assessment Tool. And this tool takes you through a series of yes or no questions. It's a real simple tool to use to see if your agency is really dementia capable at that point. So the first year when we applied for the grant, I saw the tool. I was like, no, yes, no, as far as if what our agency does specific for dementia. And then when we did not receive the grant, we revisited this tool, and we really took this tool very seriously. And we made sure that we were able to answer most of that tool as yes, which required us to expand our dementia-friendly training, expand our caregiver support through our federally funded Title VII Older American Act program. And so that tool, I just can't say enough about that tool. And we use it every year with PANDA through our paid partners, or our contractors, or if you will, to make sure that they also are, every year they're gradually reaching that to become dementia capable. So I can't say enough about that tool. And then how we identified the need, what is the need in the home? And we really thought we knew what the needs were. And I'm going to say at the end of some of our outcomes, we learned that there were other needs that we weren't aware of. So we really worked closely again with our federally funded caregiver staff and team. We worked with our Medicaid waiver case managers to really find out, what are those needs in the home? And so that really was able to give us at least a benchmark of what we knew we needed to write in the grant. And then we wanted to develop this piloted program to really so that others, we wanted to do the heavy lifting so other area agencies on aging in Alabama, or more on a broad basis, can really replicate this statewide or in their region. So next slide. So why is it important for us throughout the nation and the Aging Network to really provide these services to families struggling with ADRD and their caregivers? And I was a caregiver on 3 different occasions, family, unpaid caregiver. And, you really don't recognize when you're experiencing early signs of burnout. You just don't know it because you're constantly focusing on your loved one to make sure that their needs are met. And you really, a lot of caregivers, they don't even think about their needs. And so some of these statistics are alarming. By 2030, there will be more individuals over the age of 65 than under the age of 65. 1 in every 5 individuals. 80% of Americans know very little about what are the early signs of Alzheimer's. My mother-in-law, she was not diagnosed until way later. And my father-in-law, they were married 68 years and they both moved into our house once we knew she had Alzheimer's. But there were signs and we didn't even pick up on the signs. And one of the biggest signs for me, I came home from work and her van was still running in the driveway. And I said, Mom, your van, I didn't even ask her. I didn't want her to know she left it running. I said, Mom, where did you go today? She said, I went to Walmart. And then, but I got back in time for my story at 12 o'clock. So I knew her van had been running from 12 to 5 p.m. that day. And he had no cognitive impairment. But he had bone cancer, but he really covered for her a lot. So, you know, he saw the signs. And once we started noticing the signs, he said, oh, she's been like this for a long time. It wasn't until they actually moved in with us that we were able to kind of rally around as a family, knowing what we were dealing with. 83% of the help provided to older adults, as we all are familiar with this, comes from family members, friends, or other unpaid caregivers. And then more than 11 million Americans provide unpaid care. More than 16 billion hours, valued at nearly 272 billion. And I would say it's probably higher than that. And when because I will say when my mother passed away as a caregiver at 61, sudden heart attack in her sleep in 2001. My father had Parkinson's. He had to retire at 55. So immediately I got the phone call. There was 5 of us kids. I became the primary caregiver for him, but we all kind of rallied around together. But I didn't really consider myself a caregiver, and we didn't consider Mom a caregiver because spouses take care of spouses. That's what you're supposed to do. And so ever since then, I'm really passionate about, and then he of course got dementia with Parkinson's, and then he passed away 5 years later, but families are struggling and they need help. So I just think PANDA is a wonderful project for families to really share the care with them. Okay, next slide. So kind of what are the nuts and bolts of the grant? It was a 3-year federal ACL grant. I believe it's come out every year. The RFP, half of the funding that we received was to be provided direct services in the home, or at least to those clients that we served. And so we piloted it in one county and we created it so that it could be replicated, not fairly easily, but it can be replicated because a lot of the groundwork has already been done for you all. And then I've already spoken about who we serve, you know, people living with dementia, people living with intellectual and developmental disabilities, people living alone with dementia. We do have most live with a family caregiver, over, I would say at least 80%. But even we serve those who have not been diagnosed, but are at a high risk for dementia. So it could be your older IDD individual. It could be somebody in their 80s, because we all know that the prevalence for them to get some kind of dementia after the age of 80. And then, of course, caregivers. Next slide. This just gives you a snapshot of Alabama's aging network. I know all of us in the Area Agency on Aging field, we receive the Older Americans Act funding or grants from ACL, and then it filters down to our state of unit on aging. And then in Alabama, we have 13 local area agencies on aging. So that just gives you a picture of that. Next slide. One thing that was so important, especially when we didn't get the first grant, we said, okay, we need to really identify strong partners and build that collaboration. And so we had monthly phone calls, and we had quarterly in person. And we brought on UAB, the Dr. David Geldmacher, he's known nationally, Dr. Rita Jablonski. I won't read all of these, but Dr. Rita Jablonski, we brought her in. She created an evidence-informed behavior management training. And so we knew that that was something that our clients definitely could benefit from. So, and then we also partnered with Auburn, their Harrison School of Pharmacy. So you can just kind of see both. In Alabama, there's really two primary Alzheimer advocacy groups. And so we partnered with both of them. Next slide. And so some of the major initiatives, again, just looking in those homes, giving that support. We had the first go around as well, we did write in to help fund the City of Pelham Community Paramedic Program. They do in-home visits, especially for those frequent flyers. And again, that we learned from our partnership with first responders. And so we were able, they have a wonderful program that's being replicated in other cities. We saw the need in North Shelby County. There's quite a few adult day respite programs. In South Shelby, there's none. So we help fund 2 adult day programs. And then I've talked already about taking our dementia-friendly first responder program statewide. And again, I just can't keep saying enough about how we really did develop this so that we want others to replicate it as well. Okay, next slide. One challenge we did have, and I hate to say, but COVID hit, and that was one of the reasons, was really getting our Healthy Brain Initiative education program off the ground. People just didn't want to attend it. And again, it was virtual because of COVID. But we also went into the community and we just didn't get a lot of attendance for that. So, that was just one thing we don't have a whole lot to report on. It's very important education and training. And then we just, again, as I mentioned, we've created materials and brochures and things that are very dementia specific, did a lot of marketing. Part of the grant did require us to collect a lot of data and evaluate that data. So we brought on a third-party evaluator, which is just a wonderful partner to, and so they've been great to just help us for the whole 3 years collect all of that data. One thing I did really want to talk about quickly is the with PANDA, because it was in one county, we were able to really fast track those referrals that came into the project. So, there was never a waiting list. We have an online portal on our website for our Aging and Disability Resource Center, and we have a great staff there, but they were our case managers would get the referral pretty much the same day and could go out within a day or two if they needed to assess the situation in the home. And then we know that not specialty, but my real passion is elder abuse prevention. And so we already knowing that someone with ADRD or some form of dementia are twice as likely to be victimized by elder abuse or elder mistreatment. So we did a lot of that as well. Next slide. This just kind of gives you a picture of all the different services that we brought into the home. We did partner with our Title VII legal provider. So she did a lot of these families needed a lot of legal help. We had an amazing remote artificial intelligence bracelet called Care Predict that could be a presentation for a whole nother time, but it's a really great tool for families because they're all in the inner circle and it's on an app on the phone and it measures and documents all kinds of things in the home. One of the greatest, probably the most costly, was we provided a lot of respite care because we know caregivers need a lot of respite. We did partner with another group, they're statewide, but we found that one of the greatest needs for all of these clients was simple home modifications. I mean, it would have made or broke that family as far as falls, and because we measured falls and all that. And so that's just one thing. If you all are interested in this, just please budget some money for home modifications. A lot of supplemental supplies, and then a lot of training and education, especially for the caregiver. Next slide. This just gives you a kind of a flow of and our third-party evaluator had actually put this together when we first started the grant, with the application. So this just shows you the client services and how they flow together. And so if we knew that an individual would qualify for a Medicaid waiver program, we would go ahead and make the referral. So any client, they could receive meals, of course, but they could not receive Medicaid services and PANDA services at the same time. So that's where you see that part. We did use the evidence-based, which was required to choose an evidence-based tool that we were going to use. So we chose T-Care. And T-Care really measures the stresses and burdens. It does caregiver assessments at initially when we enroll them in the PANDA program, and then every 6 months we were able to measure, and we got some really great results from that. And then just again with Dr. Jablonski, we referred a lot of people to her care behavior resistant model, and that really helped those caregivers. You know, mom refuses to get in the bathtub, dad won't take his medicine. She really does a great job, and so she was able to do that virtually in the home as well. Next slide. So what are some of the anticipated outcomes? Well, we served 524 individuals, received evidence-based interventions, education, and services in the home. That's a lot of people for one county. I think we did a lot. People have heard about PANDA. They're, oh, I know about PANDA. And so we did a quality of life measurement. We did see a reduction in hospital visits. Again, the data maybe later, maybe by June, we'll have it available. We did increase the statewide knowledge for first responders. And again, we believe we have a highly efficient and sustainable dementia system that will be available statewide. Okay, next slide. And I just wanted to really stress the importance of integrating first responders through your work with the Aging Network in your area. They are really the boots on the ground, and we have learned so much, and we've been able to implement so many different initiatives because of their feedback and their input, including the creation of PANDA and the creation of the Elder Justice Center. And so we keep going back to them. We invite them. We've been able to create multidisciplinary teams. They said the best part of our dementia-friendly training was they did not know about a AAA. They had no knowledge that there was an area agency on aging that they could refer people in need to. And so I just can't say enough. We've got all the tools that we've created. We've got all kinds of different stuff if you wanted to email me, and we're happy to share anything and everything that we have. Okay, next slide. And lastly, I just wanted to talk a little bit about the Elder Justice Center. This is a new initiative. As you can see in the graphic design on your slide, it's similar to a family justice model or a domestic violence shelter. Well, all of the services for older adults and family caregivers are under one roof. And so we have an adult day health center. We are creating elder justice county-wide networks. We do a lot of law enforcement training, medical professional training. We're going to be expanding that training. We're looking for grants. We will be doing a lot of direct services for victims, and we will be opening a temporary elder emergency shelter, hopefully in August of this year. Okay, next slide. And then just a kind of because this is a really big undertaking for the state. We have a lot of support. It is statewide, and so we just know that our vision is we really want to reduce social isolation. And I guess, and then you could just see all the other things, but I want to say quickly before I turn it over to Stephanie, one lesson learned was when we started PANDA, we really should have connected quickly with our adult protective services staff or county staff, because on the third year and the second to the third year of PANDA, a lot of those referrals came from Shelby Adult Protective Services. They had a grant where they could come in and provide services up to 45 days in the home, but then they can't, after that 46 day, they have to pull those services out. So they immediately, quickly, once they got those 45 days of services, they worked with our PANDA case managers. We were able to step in and take care of those long-term for those families. So that is one partnership that, again, we were kind of blindsided at the first year. but a lot of our clients ended up being adult protective services clients. So I've enjoyed myself this afternoon. Thank you so much for letting us share our passion and our vision and our program. And I'm going to turn it over to Stephanie.
Thank you, Robin, and thank you to everybody for being here today. It is always my pure joy to be able to share how we got started, which is our first slide, how CAAC got started with PANDA. Passion, that's what it started with for us. My executive director had a father-in-law who had Alzheimer's, and she was motivated to apply for this grant. Now, as Sari said in my intro, I too had both of my grandparents passed with Alzheimer's. So there's that passion. But of course, we have to remember none of this would be possible without the funding from ACL. And they offer so much more than just the monetary aspect of the grant in terms of resources and support, etc. So let me just start by saying, people think that they can't be awarded grants like this, that it's unattainable in that magnitude, but we're here to tell you that it absolutely can be your grant as well. The Administration for Community Living, M4A, and then of course Central Alabama Aging, all an integral part. Next slide. So who benefits? That's always one thing that people ask. Who benefits? Who's going to benefit from this program? First and foremost, people living with dementia and related dementia diseases. You've got different diagnoses that have a higher risk for dementia. Older adults who are living with intellectual development disabilities, and caregivers. Caregivers are on the forefront, and they need to be remembered. That's one thing that when we go into a home, it's always stated that they're so happy that somebody is acknowledging them. So caregivers first and foremost, even though it's third on my slide. Next slide, please. Criteria. A plus about PANDA is that there is no financial criteria. And to back up just a second, Central Alabama Aging Consortium, which is where we work and who was awarded this grant, it makes perfect sense because there is certain financial criteria or limits over asset, over income that come into play for program to receive program services, but PANDA doesn't do that. And that's what makes it so special, because if you are a PANDA recipient, you may have savings, you may live in a very nice home, but we understand that the caregiver is struggling. The caregiver is taking care of somebody with dementia, and it doesn't matter what your monetary income is. So that's been a really plus, and it's a perfect marriage with the Area Agency on Aging, because anybody that calls in that has either a diagnosis or an at-risk for dementia, and they live at home, that's another criteria, but there's not that requirement per se for Central Alabama Aging Program services. Next slide. It's a team effort. You know, Robin talked a lot about that. We would not be here if not for ACL. She would not have been there had it not been for ACL. And then we also have to give kudos to M4A for piloting it. Why we have that passion and why we have a goal, you know, everybody in the community contributes. The joy in going out in the community and talking about this is everybody wants to help. You know, whether you're at church, whether you're at the grocery store, no matter where you are, there's always typically somebody that can relate or who knows somebody that has this deadly disease. And so it's always a plus to share with people and let them know that it is definitely a team effort. Our state agency, Alabama Department of Senior Services, has been key. They provide help with this grant. Of course, Central Alabama Aging, and then we work with Dementia Friendly Alabama. If your state is not already dementia friendly, you can reach out to us, and we're happy to tell you, because in addition to being able to receive this grant, I know that you could do it if we did it. It's just as easy, if not easier, to become dementia friendly. And I think that's a great starting point for everybody. Next slide. I'm not going to stay on this slide, but I wanted you to see, we like to give a little bit of recognition to some of our larger partners, obviously AARP, TCARE, NADRC, ACL, AFA. None of this would be possible. So we got the support, and then we realized, next slide, please. We realized that in addition to organizational support, we needed a sounding board of sorts, a board of directors per se, but not truly a board of directors. And we called it a CART, the Care Assessment Resource Team. That's comprised of different people within the community, an advocacy program. We have a social worker on hand. We have a dementia-friendly representative. We have somebody that's representative of People First, who represents people with IDD, and then of course a legal. All of these comprise our CART, and all of these play a role in helping us, because this is uncharted territory for us. Obviously, M4A piloted it, but we have a completely different set of playing rules in terms of offering different programs and making our grant different in that way. But once the CART was in place, we felt confident that enough organizations had our back, and that we could move forward with our in-home services. Next slide. So caring for the caregiver, as I said earlier, the caregiver is first and foremost. They're on the forefront. They mean everything. They help people stay at home who have, whether it be diagnosis of dementia or whether it's IDD. Without a caregiver, that person would have to be put in a facility. While our interventions are similar to M4As, they're all unique in what Robin had already mentioned about creating a person-centered care plan, not just for the care recipient, but for the caregiver. And that's what's different about the PANDA Project. And that's what makes us special and sets us apart. Homemaker services, personal companion care, respite services, you're all familiar with those services. But then, like Robin said, we've got remote monitoring called Care Predict, and we have added one called Safe in Home, which is a fall notification. We're always searching for new resources, such as Safe in Home, the caregiver tool, that alerts your care circle if you were to have a fall. That's something that becomes more prominent when you're older, falls. So if we can prevent the falls, or if we can get somebody there or notify the care circle when there is a fall faster, then we're doing our job. Caregiving interventions help reduce caregiver stress. You don't have to say that too many times and not understand it. But we have adapted all of our services specifically to educate the caregiver and healthcare professionals. Next slide. And I'm sorry, can you go back a slide, Cameron? I forgot to mention, obviously the legal services are instrumental. And we have been pleasantly surprised in that when we go into homes to do our initial home visit, many of the families that we are meeting for the first time have said that they have their legal services already in a row, and they've already got their documents situated. So that has always been a plus. But if they don't have that taken care of, we can help them look at that. And then robotic pets. I'm sure that you all have heard of robotic pets before, but if you haven't seen one and you haven't been privy to holding one, it is amazing the calmness. I need one right now. It's amazing the calmness that a robotic pet can bring you. Even though our caregivers, even though our care recipients, I think that they know that it's not a real pet, there's just a calm that comes over them when they have these robotic pets. So that's just another tool that we provide for caregiver intervention. Okay, Cameron, next slide now. I'm sorry. Education and resources. With the educational component, it was originally geared towards professionals, but we realized quickly that people, when they are in the doctor's office, that they are leaving the doctor's office with a diagnosis and nothing more. So we are working with the Alzheimer's Foundation of America to provide training for professionals, free webinars, and in-person workshops. This has been instrumental, and we have gotten so much positive feedback. The free live webinars are every month except July because of the heat of the summer in Alabama. It's just too much. And then, of course, in December. And the numbers just continue to rise with those webinars. So we realize that people are out there. People want that education. They need that education. So we're here, and ACL is, of course, helping us to provide such education. The Partners in Care, it's a myriad of healthcare professionals with skills, knowledge, and competence needed to work with people living with dementia, with their families, and with colleagues. And of course, the webinars, we have a multitude of topics. We try and of course, make them different every month. But if there is a webinar that people really have enjoyed, we do like to reconsider that for the following year. Alzheimer's Association, we're working with them as well. Again, the partnership, people want to help you. You don't have to do this alone. People want to be a part of this because there is such a need for this. Matter of balance classes, virtual dementia tours. If you've never done a virtual dementia tour, look up your area agency on aging and see if you can't go to a virtual dementia tour. As stated on the slide, it's a simulated experience, but it's something that compounds all of the different elements of what somebody with Alzheimer's might be going through. And it's very eye-opening. And it's it speaks volumes to what people are doing underneath. It's sort of like a swan that, on top of the water, they're fine, but below their feet are just going 90 miles an hour. You don't see it on the outside. And this gives you a little insight as to what's happening on the inside. So that's one more thing that we provide. And then look up, you can always go to our website as well, pandaprojectal.org. But caring for a person with Alzheimer's disease, again, we have different resources and tools that we provide. But this is something that one of our care managers, Ashley, came across. And whenever she goes in and does an initial home visit, she takes that, and there have just been countless people who have asked for more because, again, they need that knowledge. They need that information to tackle this deadly disease. Next slide. Robotic pets. You got to love them. Of course, we've got our dogs and our cats. But one thing that many of you might not know about are our walker squawkers. And I wish I thought to get one. I have one in my window. But you can put that on a walker, and it helps a person, yes, be motivated to get up and use their walker. Far too often people, when they have walkers, they just sit. They don't want to use their walker. The walker squawker will sing. And I promise, if you just hold on to it and you stroke it like this, it just coos. And I've never seen something that has been so tickling before, but they're called walker squawkers. They're through the robotic pet organization, Joy for All, I believe. But that's something new that we're also providing our care recipients. Next slide, please. Additional services, home modifications, supplemental supplies, and then helpful tools. A lot of people don't know about fidget blankets. Sometimes churches will make them and provide them to the community. Pill dispensers. Sometimes when we're in the homes and people, I can't remember if they took their pills or not, it's a sort of a lock component to it. So even if they think that they took it or they can't remember if they took it, it only opens on that particular day. So that's something that we've been pretty impressed with. Day clocks. And again, these are just all tools that help somebody continue to stay at home and thrive and live with dementia. Weighted blankets. You know, if it's not a pet in their lap and they have a weighted blanket, it just brings an easiness and helps with agitation. Dementia resource wallet cards. If you're walking, if you're out in the store, if you're somewhere with somebody that has dementia, people don't necessarily understand because they can't see that swan. They can't see those, feet paddling at 90 miles an hour. So if you can provide that to somebody who might be looking crossways at your mother who has Alzheimer's, that is a plus. And that is something that we can educate people. We can get the word out and help the caregiver live with somebody that has dementia and continue to thrive in addition. Next slide, please. Outreach services, outreach and in services. I can't tell you enough how important it is for anybody that wants to apply for the grant. If you apply and you receive the grant, which I know you can because we did it, first thing you need to do is get a website and get your outreach going. That is the one way that we are able to provide information, resources, etc., to people that we would not otherwise touch. Social media is crucial to share our education component, and that Facebook, Instagram, whatever you choose to do, that's one thing that we, seeing the numbers, we had 116 reaches the first month that we started in February and have gone to 17,000. Now those are individual reaches. So that is somebody different for each one of those reaches. That somebody might know somebody else. That somebody might be somebody that we wouldn't otherwise be able to provide a service or provide a resource to, but this helps us do that. Now, I know social media, I'm not a social media guru, but if there's one thing that I can recommend is that you get into that and you make a social media post on a daily. Post topics such as self-care, caregiver tips, Alzheimer's hotlines, activities, resources, and national calendar topics. When we can coincide or when we can be, when we can have a topic on our Facebook page that the Today Show is also talking about, that lets people know that it's more than just a post. It's more than just a Facebook post. It's something that we're caring to provide and give them these resources, the caregiver tips. And again, people don't know about a lot of these topics that we post about. The hotlines, for instance. I can't tell you one person that knew of the different hotlines that are available if it's after hours and they need somebody to talk to, but they're out there and they're resources that we, with the passion, feel like we should provide to people caring for somebody with dementia. In services, again, that is something that if we did not do that, I don't think that we would have half of our referrals. While the Area Agency on Aging, again, is a wonderful marriage to get referrals, going to churches, going to Bible studies. We live in the Bible Belt, so it just makes perfect sense. But hospitals, doctors' offices, medical facilities, we have different resources that we can just leave in the lobby. We can just leave in waiting rooms. We don't have to see anybody. But if you don't do that and you don't get that word out, people are not going to be any better off. So by all means, any in-service that you can do, any outreach that you can do, first and foremost, I think that's a wonderful thing. Next slide, please. Okay, sorry. Outcomes. So since April of 2022, we have had 60 initial home visits, provided 15 care predicts that Robin talked a little bit about. That is something that every time we provide a care predict and put it in a home, people are just amazed. It's something that you have beacons that physically go in each room that will give you behaviors, whether it's eating, whether it's sleeping, whether it's moving. And for somebody that lives alone, that might be the only contact that a caregiver, if they're not in the home, has. So that's something that they can watch and they can see what their behaviors are and talk to them about that. The robotic pets are another amazing thing. People are so happy. And the safe in home devices as well. You can get that, and I should have it on, I'm sorry, but you can either have it in lanyard form or you can have a clip to your belt, which a lot of the men like to do. One of the other outcomes is our caregivers have shown an improvement in their 6-month reassessments. When we do an initial home visit, we automatically do a 6-month reassessment, and one of our care managers was afraid to go on her first reassessment, and I guess after she did her first one and she realized after her first one and her second one and her third one, and everybody showed improvement, everybody was happier. You know, some of the comments, Larry A, for example, he only receives 2 hours 4 hours a week, 2 2-hour days. And you would think that, and I know Robin talked about this, direct service providers and the direct services that we provide are very expensive, but you don't have to, with this grant, provide somebody with, you know, an astronomical amount of hours. Larry is so appreciative of his 4 hours. We've tried to get him up to the 8 minimal hours that we have to give him. And he said he's perfectly content with that, but that the PANDA Project were the only people that would help him. So that goes straight to our heart. You know, when we have people and clients say things like that. We have another client that intentionally reaches out to us on a regular basis to thank us for our services. Marilyn and Marshall, they are a couple who he has dementia, and she takes him every week to a class where he can do exercise, but they also have a safe and home device. So one other thing too about the PANDA Project is not everybody is going to get the same service, but the joy of it is that you can receive 1, you can receive 2, or you can receive 3. You can receive multiple services, but when our care managers go into the home, they do an initial assessment. That assessment is something that they will use to figure out what exactly it is the caregiver and the care recipient need. Whether it be going to yoga, it has all been extremely positive, and we have yet to have a negative with that. And so much so that we've got people that are asking about donations. So that's always a plus. I'm sorry. People living with dementia have obviously shown the assessment, or excuse me, have shown an improvement with their 6-month assessment, and caregivers as well. And all of this is to help people stay in their home so that they do not have to go into any assisted living. Next slide. Challenges. So one thing that we all try to be is transparent. If you apply, when you apply, it's a huge challenge, but it's worth it. We are ahead. We are there striving to find out what works and what doesn't work for you. But the challenges that we have into the challenges that have come before us are trying to reach people before crisis mode. People always are late in the game, and getting our clients early enough before they're in that crisis mode is being proactive. People don't know about the services to be proactive, so that's why it's very important that we get to them ahead of time. Disseminating services, again, getting them out to healthcare providers, to doctors. This is the best way to get the word out to people that are living with the disease, and so that their caregivers can be proactive. One of our Dementia Friendly Alabama director says, diagnose and adios, because that just seems to be the way things are with doctors. You know, they diagnose and they send them on their way. So if we can get into those doctors' offices and they would let us bring our resources and our tools to provide these caregivers and these people with a new diagnosis, it would be very, very helpful, always very helpful. Direct service providers, we're getting better. It's getting easier, but there for a while, there was obviously a nationwide shortage of paid caregivers. That is getting easier. If I could recommend anything, and this was recommended to us when we started, get as many direct service providers on the line ahead of time, because you'll see that as a direct service provider, you don't have the ability just to say, go to point A, point B, or point C. You've got certain paid caregivers that like to just go in this certain area. So it's best if you just have a number of different direct service providers. Oh, sorry, I went ahead just a little bit. Pinpointing costs. You know, you can pinpoint the cost. Again, that's a challenge. You can pinpoint where your monies pretty much are being spent, but it's hard to pinpoint it in terms of how it is affecting your caregivers. If you say you want to create public awareness and you want to enhance this, that, or the other, it's hard to know exactly how much effect that you've had. So pinpointing the cost is difficult, but again, when you've got care recipients, you've got caregivers, and that's why we do this. When they're calling and they're making donations, then you know that you're on the right track, you're doing the right thing. Next slide. Statewide efforts for sustainability, that's huge. If you were to apply and get this, obviously sustainability is on the forefront because we want this to go further than just the grant life cycle. So collaborating with as many entities as possible to spread the awareness is going to gain traction. Again, the Alabama Department of Senior Services is our state entity. We've got to have them on board. Our board of directors through Central Alabama Aging and our advisory council, they have been instrumental. They have reached out to us to ask us more about the PANDA Project and how they can help us and who they can get us in touch with. Encouraging other AAAs, encouraging other states to apply for the grant. That's why we're here. You know, in addition to providing services for our caregivers and our care recipients in our service area, we're here to help other people apply for that grant and be encouraged. And also bring awareness to Alabama legislature. You bring awareness to your legislature. The more people that we can make aware, the better off our caregivers and our care recipients are going to be. Next slide. So together we can. You know, that's what I've tried to stress. My email is stephanie.holmes@adss.alabama and robinjames@rjames@m4a.org. Please feel free to reach out to either of us or both of us. And thank you again for your time today. And I hope that you all will forge ahead. We'll be transparent and we're here to help.
Thank you so much, Stephanie and Robin, for your great presentations. We'll go to some questions that we have. Can you move to the next slide, please, Cameron? So a few people were asking about the dementia capability assessment. That has been pushed out to everyone. You should have received that link in the Q&A that's associated with the webinar. I'll get to the first question, and Robin and Stephanie, you can feel free to turn on your cameras and open up your mics when you're speaking. Can one of you talk a little bit more about the evidence-based education program that PANDA utilizes?
Stephanie, you want to handle T-Care or?
And I'm sorry if you couldn't hear me. T-Care is something that our care managers use when they go into the homes. And as I discussed or mentioned earlier, doing a plan of care not only for the care recipient, but also for the caregiver. This allows us to collect information and have evidence for the caregiver so that come that 6-month assessment, we can revisit that. Because again, if we're not helping the caregiver, we're not doing our job. And T-Care has been instrumental in helping us do that and collect data.
Robin, anything else you want to add?
Just that it really measures stress levels, depression, burdens, identity discrepancies. I've never used it personally, but they say that it's really, they did go in for the purpose of PANDA. T-Care went in and made a lot of changes for us. So a lot of improvements to it. So it's a powerful tool, and we have seen some really great results.
Great, thank you.
Sarah, if I can add, identity discrepancy is something that's huge for our caregivers. They shift from being the daughter, the son, the father, to just the caregiver. And that adds so much more stress than if they were. I mean, there's enough stress being a daughter, there's enough stress being a wife, but having to be a caregiver on top of that. And that has helped us gauge where their stress is, what we can address, how we can go in and help them. So that has been extremely beneficial, and it's been consistent.
Great, thank you so much. Robin, you talked about the tool that you use that addresses difficult behaviors. Can you talk a little bit about that real quick?
Yeah, Dr. Jablonski had created videos. She really does. She asks a lot of questions of the caregiver, what those behaviors are. And then she uses, she's done a lot of studying about it, and it is evidence informed. It is not evidence based, which is close to evidence based. But she works directly with them, and she walks them through scenarios and responses to those scenarios often. So it's not just a one-time, 1 hour. It could be done virtually, again, probably more virtually than in person. But she really, and then she follows back up with them and just works with them continuously to handle those behaviors.
Great, thank you. Just one more question that I would love to have you answer is, we know you currently have grant funding to run PANDA. Are there any costs to clients right now? A lot of people have asked this about how everything's being paid for, and I know you went a little bit into sustainability, Stephanie, but can you just touch on that in terms of costs for the future and how you think that this will work out?
Well, on our end, we're already looking ahead, looking to the future. We obviously want to gauge what is working best. Direct service obviously is one of those components to be able to allow someone to receive respite or personal care or homemaker services. So to be able to sustain that and have that sustainability, whether we raise money, whether it's through donations, that's what our goal is to do. We're going to continue this and get out and get those big wheels per se, and get people to help us, because it's obvious that this is a need. This is a great need. Like Robin said, in 8 years, there will be more people over the age of 65 than under the age of 65. If that's not an eye-opening experience or not an eye-opening statistic, we need to do something and we need to do it now. So we're going to do what we can, and we're
Great.
going to sustain that.
Great, thank you. We actually have run out of time, so I just want to give a quick goodbye and thank you to our speakers and to our participants. And we're glad that you joined us today for the National Alzheimer's and Dementia Resource Center webinar series. Our next webinar will be February 23rd, 2023. The presentation will focus on innovative programs for people living with dementia that were developed during the pandemic that actually have been maintained due to their success. So some of those silver linings we'll talk about. So you can look for the registration that will come in your email. And if you have any questions, you can contact us at NADRC-webinars, plural, at rti.org if you need more information. And we hope to see you there. So thank you everyone for joining us, and have a wonderful afternoon.
Thank you so much.
Thank you.